That similarity, is that why a lot of medications are tested on animals?
Exactly,
Okay.
because it can't test for everything. But when you go from testing on a mouse to a rat to maybe a cat to a dog, all those things are getting done to make sure those things are going to go better in people. And that's, again, the similarities of how their bodies are. And of course there's differences. For example, Tylenol. People can take Tylenol, cats can't. But that's one of the main reasons of animal research, is to protect people.
Okay.
And again, that's a similarity on how the body works.
So whether you're for it or against it, it's almost a, I hate to say necessary evil, but it's just something that has to happen.
It's hard to get around it. It's hard to get around it because you can do all the computer models, all those things that you can do research-wise, but till you're sure an animal can tolerate it, a mouse can tolerate it, etc., it's hard to know if a person can.
Okay. One of the areas that seems to have come leaps and bounds are the legs, care of the legs of the animals. And I know we have a bigger dog, and I always worry about his legs taking the force of some of the things that he does. Obviously, they were created that way, and most of the time they're in good shape, but they can have many of the same leg ailments, for instance, that people have, such as a ligament damage, torn ACLs, things like that.
Yeah, the orthopedic part of animal medicine is almost identical to that in human medicine. ACLs, for example, hip problems, for example, they're the same. With dogs now, what we see, and cats for that matter, is you see more ligament ruptures in the knees than what we used to see a lot more of were hip problems.
Okay.
Well, now over time, either from genetics or breeding, you don't see as many hip problems.
Okay.
They happen, but not as often. Now it seems like lame dogs, a lot of times it's their knees, not their hips, where 20 years ago that was different.
Okay.
So that's a change that I can't quite explain. But again, the point of similarities is the knee of a dog is like a knee on a person,
Okay.
except the angles are different.
Okay. You brought along a couple of models, and maybe you can, Jeff will get a close-up shot there of it, but maybe you can
Sure.
show us the anatomy there, give us a quick anatomy lesson of what the different things are and how they might be similar or different from a person's.
Will do, and this is a knee, and this could be my knee or a dog's knee. It really doesn't matter. The only difference that you would see from an anatomic standpoint is the angles are a little bit different.
Okay.
So the top bone's the femur, just like us. Then you've got the tibia and fibula, and you've got the kneecap. The kneecap's in there too. Dogs and cats have the same thing. And the patellar tendon. Now on the inside, it's the same thing. You've got meniscus or menisci. Those are the little cartilage pads that help support our weight. And then one of the things we wanted to talk about today was, in the inside, there are cruciate ligaments, just like in a person. And that is the most common knee problem in a dog, is a lot of times they will tear the ACL, anterior cruciate ligament, just like a person, or a cranial cruciate ligament is what it's called in a dog. And what that leads to is instability in the knee joint. And what happens then is the tibia can move back and forth when the ACL is torn. And so that's my knee, your knee, it's the same. But when the ACL tears in a dog or a cat, you've got an unstable joint.
Okay. Is the repair then pretty much the same between a person and a dog?
The repair is different. And the reason the repair is different is the joint is too small to replace the ligament on the inside of the knee.
Okay.
So a size issue is there.
Oh, okay.
Whereas in a person, you have the room to rebuild the ligament on the inside. Mm-hmm. In a dog, there isn't enough room in there.
Okay.
Can't do it. So one of the differences is that we put a fake ligament on the outside of the joint. And that ligament that we put in recreates what the anterior cruciate ligament used to do inside the knee along the side of the knee.
Okay.
And I have a model to show that. And so essentially, this is a polyethylene suture that is wrapped around the back of the femur, which there's
May
an
want to
area
hold
called
it up just a little. There we go. Bring it. There we go. Live TV.
Yeah, tough to see. Okay, so the fibella is here. We wrap this polyethylene suture around the back of that, drill a hole in the tibia, and then this suture recreates the tightness that the knee used to have with the ligament on the inside of the joint. And again, this is done because now there are other ways to fix an ACL, and it'd take 10 hours to go through all the options. This is one of the most common ones. And then what is done is on that suture, so you don't have to tie a knot, we use a crimp. And it's a little stainless steel crimp.
Wow, that is tiny.
And the polyethylene suture passed through it, and then we use the crimp tool to pinch areas in the tube that holds the suture in place.
Okay.
So then you don't have a knot in there.
Wow.
So that is how the differences are. And again, there's a lot of ways to fix an ACL in a dog. That's the most common way, works well. It's just different than what's done in a person because of the size of the joint.
Okay. Have there ever been instances where something a veterinarian may do on a animal translates over into something that the human physicians go, wow, that's a pretty good idea?
Some of the surgical instruments that are used today were invented in the past from veterinary surgeons.
Okay.
Very common. Very, very common for researchers, veterinary researchers and human researchers to share ideas, share plans, to try to help both groups of people. Sure, it happens all the time. It's happened for 100 years.
The instrument design coming from the fact that what you guys do as veterinarians is on a much smaller scale, perhaps, or?
So, sometimes from that, but probably the most important thing is you have two different groups of researchers coming up with ideas.
Okay.
And so whenever you have more people thinking about ways to do things, somebody comes up with a great idea. A lot of times those things are shared.
Okay.
And we steal a lot of knowledge and information from human physicians. Mm-hmm. And so there are some times that they get information from us, and it's certainly shared back and forth.
Wow, that's amazing stuff, and stuff that you never really stop and think about is those similarities between us and our pets.
Yes, it is fascinating, and you see it all the time with new things that are coming out. And human medicine is usually about 10 years ahead of us.
Okay.
If they're doing it in human medicine, chances are we're going to be doing it in 10 years later. Mm-hmm. And one of the biggest things now is cardiac ultrasounds.
Okay.
You used to never have that done in a patient, an animal patient. Mm-hmm. Now we can do it all the time.
Mm-hmm. How do you go about in the area finding out what veterinarians can do what procedures? I mean, you've got a veterinarian that you love, been with him for 10 years. Do you guys help each other out? Do you guys share patients sometimes where maybe you can do something this guy over here can't? Can he send that pet to you?
Yeah, and I will tell you, veterinarians do not like to guess, and they don't like to try things that maybe there's other people that know that project or that procedure better than what another veterinarian does.
Okay.
You know, there are things, I haven't worked on a horse in 25 years. Did I study them? Sure I did. But if I had a sick horse of my own, I'd call Dr. Wiley.
Okay.
So there are things, veterinary medicine is getting so specialized now that we can't be great at everything.
Okay.
My point in telling you that is, if you have a complicated medical procedure that needs to be done or a complicated medical issue, and you ask your veterinarian, they're going to tell you, look, we can do this, we're comfortable doing this, or no, we're not comfortable
Okay.
doing this. This is something that's not our thing.
Okay.
A veterinarian will tell you what they can and cannot do.
Okay, and then taking that one step further, and I know you guys helped us years ago when we had a young pup that kidney didn't develop. There are clinics at different places like Columbus, Cleveland,
Yep.
that specialize even further
Exactly.
in a tighter area.
Right. There are specialists that only deal with eyes, only deal with the heart, only deal with orthopedics, only deal with spinal surgery. So, and again, veterinarians don't like to guess. If they can't do things, they're not just going to try it.
Okay.
They will get you to where you need to go.
We talked a little bit about the science fiction aspect of it, looking down the road about possibly sharing organs and things like that. As you read the different journals and see the articles and go to the conventions and things, you talked about, what's kind of coming up now with the ultrasounds of the heart and things like that. What's next? What do you see as the next big thing?
Boy, I tell you, probably what's going to be next is better eye care, probably hopefully more cataract surgery, because right now cataract surgery is done in dogs, but it's almost prohibitively expensive. I hope one of the things that the future is that some of the things that can be done now that are frankly too expensive for most people to deal with, some of those things have got to come down in price.
Okay.
For instance, I'd love to be able to do an MRI on some of my patients. I'd love it. My hope is 10 years from now, it's more feasible to do that MRI. So I don't know if there's going to be a whole new array of things that we can do, but hopefully the things that we need to do are more common, priced a little easier, that we can make all those things happen.
I don't think it's any secret that human doctors, of whether you're a general practitioner or a specialist, whatever, frustrated by the cost of procedures, the cost to them, the cost to the patient, the issues with insurance, so on and so on. Is the veterinarian community hit with that as well? I mean, it sounds like you are based on your last answer, but do you guys, I mean, I'm sure you control what you can control, but do you get tired of how things are prices are raised and things go up in price?
Yeah, and some of the things just make no sense. Some of the drugs that we could get 10 years ago that were darn near free are 10 times what they used to be.
Okay.
Some things you can understand. I understand that an MRI is incredibly advanced, and I understand an MRI, if it's $15 or $100 or $2,000, I understand why that is. But why an eye ointment that we used to get for 50 cents is now $20.
Okay.
Or an antibiotic that used to be darn near free is now incredibly priced. Those are the kind of things that get frustrating. And of course, we are pet owners too. The vast majority of us don't have insurance for our pets.
Okay.
When we have something to do, it comes out of our own pockets. So then we have to try to help the client and the patient run a clinic and keep everybody happy, and that's sometimes hard to do.
Is pet insurance something you see coming on more and more, and is it a good idea?
I don't know if it's a good answer. I think a lot of people, more people are getting it now than they used to, but I also am a believer that if insurance is covering everything, I really think there's price inflation, and then those people that don't have insurance, there's no way to keep up, because I think with that, if I need an MRI right now, I don't quibble over the price because my insurance company is going to pick it up.
Right.
Well, what happens if I don't have insurance? So, this may aggravate a lot of veterinarians. I'm not a big fan of pet insurance because I think the first thing that's going to happen is when everybody has pet insurance, or should I say, when 25% of the people have pet insurance, prices are going to keep going up. And then the 75% of people that don't have pet insurance aren't going to be able to afford to do what's built into the price.
Yeah, wow. Well, we could keep talking about this for a long
geez,
time, I think, but we've got to wrap things up. So, Mark, we appreciate you coming on tonight. WorcesterAnimalClinic.com, 330-262-3336. Thanks to Jeff Davis, our producer-director tonight. This is Mark Glasgow. Have a good night from all of us at Panorama.